Hi everybody, this is Dr. Nate from Back to Health, and one of the things that we specialize in treating at Back to Health is spinal disc injuries. Perhaps you've heard these referred to as slip disc, herniated disc, bulging discs. They can produce symptoms like neck pain and muscle spasms, back pain and muscle spasms. You can get radiating pain, numbness, or tingling going down the arms into your hands. You can get leg pain, foot pain, numbness, and tingling, something that's commonly referred to as sciatica, all signs of having a disc injury. Basically a disc injury the spinal disc is kind of built like a jelly donut. So a disc injury is where the jelly pushes out of the donut. It can push out a little bit, it can push out a lot. But when that begins to irritate or even pinch the nerves, the ensuing pain and functional deficit and the disability can be quite overwhelming. One of the questions I get asked a lot about spinal disc injuries is this going to heal? And really what the patient is asking me is, am I going to need surgery? And that's what people want to know. The short and quick answers is the odds are overwhelmingly in your favor that spinal disc injury is going to heal. And the odds are overwhelmingly in your favor that you are not going to need back surgery. Whenever we answer these types of questions, one of the things that I do and I like to do to guide my practice and how I work with my patients is we just refer back to the research. I got a couple of papers here. I'd like to read some excerpts for you. There was a paper done by Monument in 2011, and in this paper he's saying, follow-up MRI 6 to 12 months after the initial injury demonstrates that 50% of patients see about a 70% decrease in the size of their disc herniation. So here we have a study where they did an MRI from patients that had, let's say, sciatic pain, and then 6 and 12 months later they did follow-up MRIs, and they're showing that 50% of those patients, the disc herniation actually shrunk and got smaller. It really wasn't too long ago where we actually believed that was not possible. That was not the case. Once the jelly squished out of the donut, it was out permanently and there was nothing that we could do about it. We now know that that's not the case. In about 40 to 60% of patients, the disc herniation actually shrinks. It happens over a period of time of about 6 to 12 months. And what we understand is there's a couple of different ways that occurs. One of those is just the natural healing process. The body's naturally going to want to take that jelly and kind of chew it up and reabsorb it. The other way is various therapies that we can apply to the spine. One of the things we use at Back to Health is we use something called intermittent traction, which is a table the patients lay on, and we very gently will traction the spine. And what we're trying to do is create what's called a negative intradiscal pressure. Negative intradiscal pressure is basically creating a vacuum on the inside of the donut to try to pull the jelly back inside the donut. With the body's natural healing abilities coupled with the traction therapy that we apply here at the office, we get really, really good results with spinal disc injury patients. Another question that patients are always asking me again was, am I going to need surgery? And I will tell you the chances that you're going to end up in surgery from a spinal disc injury are relatively low. Here's a study done by Saul in 1996, and it says, in a retrospective cohort study, Saul demonstrated that lumbar disc herniation with radiculopathy, like sciatica, can be successfully treated non-operatively, with non-operative treatment resulting in good to excellent outcomes for approximately 90% of patients. So in 90% of patients in this study, not only did they make a recovery without having to go through surgery, the recovery was rated as good to excellent. Another paper here that I like is done by Jacobs, and in this paper he says, after 1 year, there was no difference between surgical and conservative interventions. So here they took a study of patients and they divided them into two different groups. Group A got conservative care, which is the kind of stuff that we do here at Back to Health, and Group B got surgical intervention. And what they found is at the 12-month mark, there was really no difference between patients that got conservative care and patients that had surgery. That's not to downplay the type of pain or discomfort you may experience from these types of injuries. I personally think it's one of the worst types of pain that you can possibly experience. So it's not uncommon during the early phases of recovery that I encourage my patients to actually use some pain management, perhaps over-the-counter anti-inflammatories, prescription strength anti-inflammatories, even epidural injections. These are all things that can help control pain. and give the body enough time that it needs to actually go through the healing process to reabsorb and heal that spinal disc injury. The last point that I like to point out is that patients will come into me and they'll say, well, you don't understand, doc, my MRI, it's a huge disc herniation. Like, the bigger the disc herniation, the worse the situation, the more likely it is they're going to end up in surgery. I will concede to you that the larger the disc injury, frequently that correlates with larger amounts of pain. It's very discomforting, but the research actually shows us that the larger disc herniations, the blowouts, if you will, actually respond a little bit better and they heal better over time. Here's a paper done by Jensen in 1996. It says larger extrusions and sequestrations are more likely to reabsorb. So again, just because it's a large blowout, there are a few things that we need to check you for and make sure aren't an emergency surgical situation. But just because it's a large blowout doesn't mean immediately that you're going to end up in surgery. I hope you found the video interesting. If you have any additional questions or concerns, don't hesitate to reach out to me. You can always email me. It's drnate@getback2health.com. So it's drnate@getback, the number 2, and then health.com. The other thing you can do is you can always go to getbacktohealth.com and go to our video section, our video library, and look at the section for patient education resources. There's a video I did on there called Spinal Disc Injury Basics. It's a little bit more in depth than this video, and it can help answer some of the common questions that I get. I hope you found the video informative. Have a great day, and if you need anything, reach out to me.